And with that, I am going to pass it on to Dawn Watkins, our director at the SoCal Black Worker Hub.
Thank you, Melissa. Good evening, everyone. Welcome and welcome back to those who this is not their first rodeo. Before I dive in, just a quick show of hands, maybe a one in the chat if you've been here before, or a two if this is your first time. We've had this Edu-Series under Echo Black Voices all last year. And so if you've been to even one of them, just drop a one. Okay, coming through. A couple people. This is not your first rodeo. Welcome back. For almost the other half of folks, this is your first time. Great. Just wanted to get a good sense. All right. So for those who have been here before, you've heard a lot of this, so you get to hear it again, and then maybe you'll become a practitioner in talking about Echo Black Voices and CWOP in your workplace and in your community too. And for the new folks, there's a lot that you'll get to walk away with and learn about tonight. So yeah, I'm Dawn, the director of the Southern California Black Worker Hub. Who are we and what is the purpose of all of this? So the Southern California Black Worker Hub, we coordinate and organize with Black Worker Centers all throughout Southern California, Black Worker Centers in San Diego, Inland Empire, Los Angeles Black Worker Center. By the way, this is the 15-year anniversary for the LA Black Worker Center. So put a little party emoji for that. That event is coming up September 28th, which you'll hear about at the end of the night. And then two other newer Black Worker Centers, one in the High Desert, where a lot of us as Black people have been moving out towards over the last, decade or so. And then the Long Beach Black Worker Center, as well as our other two partners, the Earth Lodge Center for Transformation and Care at Work through the UCLA Labor Center. And so we coordinate, organize, provide capacity building support with our partners, and for sake of building Black worker power, for sake of ensuring Black worker justice, for sake of ensuring that workers are understanding their rights and have resources and tools and how to respond when our rights get violated. So that is a little bit of the purpose of this. This is through partnership with the California Coalition for Worker Power. In fact, sorry, who's running slides? Should I just call?
I am, yep.
Okay, all right, thanks. So yeah, I love these. Darren also usually does our introduction. Darren is our program manager. He is out today. And just talks about the struggle being real for Black workers and our families and the exclusion from many industries, and the need for wellness at work, for our rights being protected and supportive resources. Right together, we're organizing, we're advocating for equity, accountability, increased economic opportunities, and collaboration is everything, and partnership with policymakers, right, community partners, representatives of state agencies, which we can go to the next slide now, Mel. Yeah, we can, well, yeah, we'll pause. I'll come back to the partnerships, but yeah, the other part of the purpose is what we call our apps, which is access, pathways, and protection. So access to various industries that oftentimes folks are feeling like we've been, kind of because of, just to be blunt, systemic racism and anti-Blackness, right? So access to various industries, pathways into those industries, one of which is the healthcare industry that we'll learn a lot about tonight. And so this entire series, Edu-Series, every month will be an introduction of discussion and introduction and opportunities to access and pathways with various industries. And so tonight it's healthcare, next month it'll be a different one. And then of course, protections, and that includes being well at work, being safe at work, and organizing. Oftentimes when we're experiencing violations of our rights, our options are things like file a claim with the EEOC or with the wage, with the Department of Labor or the Labor Commissioner's office, or another option might be file a lawsuit. And sometimes just organizing in our workplace, right? We'll talk about what that is a little later and what that means and how we can do that, can often resolve challenges far sooner than waiting 8 months for a representative from EEOC or 3 years for a lawsuit to get complete. So that's a little bit of our purpose and intention for the evening. We can go to the next slide. And so, yeah, this is a partnership with the California Coalition for Worker Power, CCWP, which is a group of about 80 or so worker centers across the entire state, in collaboration with the Department of Industrial Relations under under CWOP, California Worker Outreach Project. As well as with Cal OSHA, as you see there, the Labor Commissioner's Office, Division of Worker Compensation. Yeah, so it takes a village, and yeah, and this is the rest of the village, right? So this year we're also expanding our California Worker Outreach Project partnerships with other organizations who may not currently be worker centers, but they are Black-led, Black-centered, doing amazing work in our communities around whatever the various issues may be. Maybe it's housing, maybe it's anti-recidivism, maybe it's around whatever the issues are, right? Whatever the conditions are that folks are seeking to change in our communities, but wanting to also include a worker lens and making sure that we're including an identification of ourselves as Black workers to make sure that we're protected while folks are working on the respective issues that they're working on. Maybe they're a service provider organization, right? But they're touching people. We want to make sure that we're engaging our folks, educating them and inviting them into these processes. So our other partnerships include Black Women for Wellness, the High Desert Black Worker Center, Long Beach Black Worker Center, the Sixth in Long Beach that does a lot of political education work in the city in Long Beach, Demo Chicks, already mentioned Earth Lodge, San Diego, and IE Black Worker Center. And now tonight, right, an additional partnership with experts in the various industries that we'll be bringing to you every month. And tonight that is also with SEIU, Service Employees International Union, UHW, United Healthcare Workers, and Futuro. And I saw Ontario Future there, and it made me think about Futuro, so it made me mention them, but they're coming up in a moment. But yeah, Ontario Future. So these are folks from all over Southern California. Next slide. Did we drop their, yeah, their contact information is there in the chat. If you want to follow these partners and see more about who they are and what they're up to, definitely follow the chat and you can find our partners there. And so let me transition and really get to the meat of our event tonight. So like I mentioned, every month we want to make sure that we are bringing access, that we are bringing opportunities, that we're bringing education. And so again, tonight, that topic is on healthcare. So whether it's you yourself that's looking to get into a new industry, change your career options, maybe you have a niece, a daughter, a relative, a homie, a friend, somebody who you know is looking for an opportunity for a real career. And so this is one of those opportunities tonight. Again, with SEIU and Futuro. And so I want to transition us and introduce Cynthia Paredes Alvarado and Yvonne Shepard to take it from here for the next 25 minutes or so. We want folks to know that we're going to review what these opportunities are, what these pathways look like. We're going to come back from this review. There'll be we'll talk a little bit about organizing at work, There will be a Q&A, so you can ask some questions, and then we'll share with you some upcoming opportunities to stay involved with, and we'll close. But for folks who are interested in these opportunities tonight, you'll get the chance to stay on and actually enroll tonight. So, so plan, for those last 15 minutes or so for your enrollment into the opportunities if you're ready. And there'll be contact information to share or for you to come back for when you are ready if you aren't tonight. So I will pass it over to Yvonne and Cynthia.
Hello, everyone. So my name is Yvonne Shepherd. I'm one of the education ambassadors that's going to lead you through this presentation today. Along with me is Cynthia Paredes Alvarado, which is my education organizer. So we're happy for you guys to take your time, to listen to the information and just, be excited about some of the things that we have going on. Okay. Next slide. So I want to give you a little history of who SEIU-UHW, growing the healthcare workforce, okay? So, we're a labor union that represents more than 100,000 healthcare professionals in California. We're an organization that fights for the healthcare justice to make sure all Californians have access to quality, affordable care provided by value-respected healthcare workers. SEIU-UHW is more than just a union. We're also on a mission to grow the healthcare workforce by offering complete healthcare education resources to recruit and build the workforce needed to tackle the staffing shortage. Do we have a next slide? Oh, next slide. Okay, thank you. So during 2019 bargaining with Kaiser Permanente, we want the funds to establish this organization. They provide scholarships, mentorships, and training opportunities for family and friends of SEIU-UHW members who are serious about a career in the healthcare field. Futuro Health is a major way that our union is addressing the healthcare worker shortage. Futuro Health puts expiring healthcare workers on a pathway to strong union jobs by offering the education, the training, and support needed to join the healthcare workforce. Futuro Health has partnered with the education providers across the state. By investing in the education and development of healthcare professionals, Futuro Health hopes to improve access to quality healthcare for all Californians. So since 2020, Futuro Health has enrolled more than 10,000 students by providing affordable training programs that focus on the classifications employers want. 90% of our students are ethnically diverse, 46% are bilingual, and 75% are female, and the average age is about 29 years old. Next slide, please. So, the question we ask, are you start ready? We are looking for quality scholars for our healthcare education programs. They can be committed from start to graduation. We want serious applicants should be ready to start a program. Applicants should be ready to start within 2 weeks after applying. We have rolling start dates throughout the year. Commitment to work in healthcare. Applicants must make a commitment to work in the medical field after graduation. So again, ask yourself, do you see yourself working in a hospital or a clinic? Select a program. You must choose a program when you fill out your application. You cannot switch programs once you are enrolled in a program. Programs are self-paced with weekly assignments. And then constant communications. You should be in constant communication with your Futuro Health Success coaches, which means you must be on the lookout for emails, phone calls, and texts. Please respond promptly. Check your emails for frequent check your emails frequently. And then if your success coach is unresponsive, you must email help@futurohealth.org. And these information will be dropped in the chat so that you can get them. When we're done with the presentation, you'll have all the emails. And then computer. You must own or have reliable access to a working computer or laptop that is 5 years or less old. Chromebooks, iPads, and smartphones are not acceptable and cannot be used to complete your coursework. Next slide, please. Also, study time. Applicants must commit to the duration of the education program. You must commit 3 to 4 hours minimum of study time per day. You must commit to one program and understand you cannot switch if dropped from the program, or if you fail the program, you will be ineligible to reapply for another program. Although you can get a tuition-free scholarship, Futuro Health pays for your tuition to the school that you will be attending. And then vaccination. Education providers have made vaccinations mandatory for enrollment. So if you have an exemption for the COVID vaccine, it must be approved by the education provider. So most healthcare employers also require vaccinations for employment. And then an unpaid full-time externship. Applicants must commit at the time of acceptance to an unpaid full-time externship to complete the program, which means you would need to take time from other responsibilities and must prepare financially for this unpaid mandatory externships. Externships are provided by the education provider, and the hours are Monday through Friday, 8 hours per day, and it will be a day shift. So you must be flexible with the location for your externship and clinical labs. And it can be up to 50 miles based on home address. And then we also have career counseling. Futuro Health is working with Allied Up for career counseling. And so Allied Up works with the employer partners for job opportunities when available, but we do not guarantee job placement. Next slide. Do you meet the minimum requirements? So here are the basic requirements to apply for a Futuro Health Pathway program. Remember, these are the minimum requirements, so if you do not meet them, your application will be denied. You must be 18 years of age or older to apply, a California resident able to work in the U.S., have your high school diploma or GED, own a computer or have reliable access to a computer, and have reliable internet, and then be able to commit 3 to 4 hours per day study time up to 20 hours per week. Have your up-to-date immunizations, including COVID vaccine, and must be referred by a UHW member in good standing. And then make sure you have your referring SEIU-UHW members, their name, the facility, the last 4 digits of the employee number, and their division, whether they're Kaiser or hospital, which we would provide that for you. You are not to be able to apply without this information. Next slide. So let's get to the good part. What are the program fees? There is a non-refundable $150 application fee. Payment is due once accepted into the program. Then you must be able to pass a federal drug screen, marijuana use included, and a background check, which costs $77. There are no upfront costs for you to apply. These are your only fees that you have to pay for your entire program. Next slide. So these are the mandatory vaccine requirements. These vaccines and blood tests are required by the education provider. The 2 MMR, the measles, mumps, and rubella, the 2 Varicella, which is the chickenpox, 3 hepatitis B, the COVID-19 vaccination, and then your one-step PVD, TB, or blood test showing non-infections. Now, some of these are vaccines and some of these are blood tests, okay? We'll drop a link in if you have any questions regarding any of the vaccines at help@futurohealth.org prior to applying if you have any questions regarding the vaccine requirements. Next slide. So the Human Touch Healthcare Jumpstart course provides students with the essential interpersonal skills to become excellent allied health professionals. So these 6 competencies is what our employers are looking for when hiring. So you must complete and pass this course to move into your program. Once your application is approved, Futuro Health will enroll you in the Human Touch Healthcare course. So we have a slight little video we want you to listen to.
I entered into healthcare as a community health worker. There's different tracks for a community health worker. There's the community-based and the clinic-based. If somebody is in a clinic-based, they need to know how to work with electronic health record, HIPAA compliance, how to document in a patient chart. Or it could be something on specific around chronic disease management, hypertension, diabetes, etc. So we do kind of the preventative work on one hand with our community-based services, but then we have the specialty clinical work. So everything from school-based programs to really empower youth to harm reduction, coping and resiliency strategies. And then we do community-based education with a specific emphasis on underserved or vulnerable populations. So we work with families, with children, do a lot on lifestyle practices, recognizing that chronic diseases are a lot about lack of resources, poverty, a direct correlation with the social determinants of health. And so we really empower individuals with the knowledge and the tools so that they can thrive.
So my name's Yanni Lucas. I'm a community health educator. There's really no typical day or week as a community health educator. It really depends on the needs of the community. One key responsibility is to go out and do outreach. Our target population currently is parents of preschool age children. They're really focusing on getting parents like tools and strategies to help themselves and their children. It's a very fulfilling job. I really enjoy having that connection with the community, knowing that you're making a difference.
Our community health workers has passion, compassion, is empathetic, really can connect to people with where they're at, come without judgment. It's really recognizing that the folks that we're serving are really struggling, and so we need to be able to create a safe space for them.
Okay, so again, remember this is your prerequisite for all the pathway programs that we have. It's mandatory 6-week course with 1 weekly live session on Zoom. It's 100% online. It's self-paced with weekly assignments and a live class with an instructor. Must pass the Human Touch Healthcare course in order to move into your pathway program. Next slide. So now that we know what's needed to meet the minimum qualifications, let's review each program open for enrollment. We currently have these amazing opportunities open for enrollment for our friends and family who are serious about getting started on a pathway job in healthcare. These tuition-free programs represent the classifications that are in the greatest need, both in our facilities and in the state. So we're going to review each program so you can be sure that the opportunity is for you. We have our emergency medical technician, our certified nursing assistant, our community healthcare worker, our emergency room technician, our healthcare customer service paraprofessional. We have our medical assistant, our patient care representative, our patient care technician, and our peer support specialist. So these are the programs that we have open for enrollment. Next slide. So raise your hand if you're in the San Diego area. If anyone here is in the San Diego area, These are the programs that are available to you, which is the emergency room tech, medical assistant program, our patient care technician, and our phlebotomy. So let's review each program. Next one. Okay. So our emergency medical technicians, the EMT, provides basic emergency medical care, gives CPR, evaluates illness injuries, control bleeding, and stabilize patients to prepare them for transport to hospitals, where their crucial knowledge and ability to make swift decisions. EMT play a crucial role in responding to emergencies and providing life-saving interventions in urgent situations. This is a 5 to 6 month program with a required in-person 12-hour ride-alongs. We have statewide locations, and you must have a current California driver's license. Our second new program is the CNA Pathway Program. Certified nursing assistants are the backbone of the healthcare system. They work for hospitals, assisted living facilities, medical clinics, and home aid services to assist patients with daily tasks. They help patients feel as comfortable as possible and work closely with our medical professionals. This is a 3-month program with required clinical labs and a full-time externship. And we do have statewide locations. Next slide. Our next pathway is the community health worker. This is a 10-week, 100% online with a 40-hour externship. Community healthcare workers can help with issues that affect people every day, such as the need for preventive treatments, behavioral health issues, and the management and prevention of infectious diseases or chronic disorders. Community health workers can also assist medical members in assessing appropriate services for prenatal care, sexual and reproduction health, aging, injury, oral health, environmental and climate-sensitive health issues, domestic violence, and community violence prevention. Again, 10-week, 100% online. And we have a video we can play.
I entered into healthcare as a community health worker. There's different tracks for a community health worker. There's the community-based and the clinic-based. If somebody is in a clinic-based, they need to know how to work with electronic health record, HIPAA compliance, how to document in a patient chart. Or it could be something on specific around chronic disease management, hypertension, diabetes, etc. So we do kind of the preventative work on one hand with our community-based services, but then we have the specialty clinical work. So everything from school-based programs to really empower youth to harm reduction, coping and resiliency strategies. And then we do community-based education with a specific emphasis on underserved or vulnerable populations. So we work with families, with children, do a lot on lifestyle practices, recognizing that chronic diseases are a lot about lack of resources, poverty, a direct correlation with the social determinants of health. And so we really empower individuals with the knowledge and the tools so that they can thrive.
So my name's Sienny Lucas. I'm a community health educator. So there's really no typical day or week as a community health educator. It really depends on the needs of the community. One key responsibility is to go out and do outreach. Our target population currently is parents of preschool age children. They're really focusing on getting parents like tools and strategies to help themselves and their children. It's a very fulfilling job. I really enjoy having that connection with the community, knowing that you're making a difference.
Our community health workers has passion, compassion, is empathetic, really can connect to people with where they're at, come without judgment. It's really recognizing that the folks that we're serving are really struggling, and so we need to be able to create a safe space for them.
Okay, so I know we've seen that video again. If we can get the one with about the prerequisite, we'll have it later on, okay? And so let's talk about our emergency room tech. You know, the ER techs are trained emergency medical techs who work in a hospital emergency room instead of an ambulance. As an ERT, you provide treatment for emergency patients under the supervision of a certified nurse. You may access patients, move patients and specimens between units, communicate with patients and their families, resuscitate patients, and when necessary, collect blood from patients and monitor patients. This is a 5 to 8 month program, including required full-time clinical externship. What's great about this program is also a bundled with the EMT. You get a phlebotomy certification and an EKG tech certification. The graduate will complete 3 program certificates leading to the emergency room tech role in an acute care settings, be able to lift 50 pounds unassisted, and this is currently not available in the Sacramento region. Next slide. Okay, so our healthcare customer service paraprofessional program is 100% online. It's 5 to 6 months. To apply, you must have 1 year customer service experience. It does not have to be in healthcare. It could be in fast food or retail. There is no clinical externship required. And upon completion, you can work as a teleservice rep, a cashier receptionist, a call center representative, a central appointment clerk, customer service representative, and more. And then you can also sit for the customer service professional certification through the National Customer Service Association. And then also there's also an additional micro credential available for the telehealth. Okay, again, 100% online, 5 to 6 month program. Next slide. So our medical assistants are an extra set of hands for doctors and nurses and are essential overall to our patient experience. So MAs perform clinician and administrative duties while gaining an overview of many different roles within the medical field. This is an 8 to 12 month program, including in-person clinical lab and required full-time clinical externship. We have statewide locations and state certification. And let's look at a quick video.
My name is Cassandra. I'm at MTI College in Sacramento, California, studying medical assisting. I was a preschool, infant, toddler, and kindergarten teacher for 8 years. When COVID hit, I decided to take a leap of faith and switch my career. My older cousin, who referred me to Futuro Health, she found out that I was trying to get into the medical field. And she was explaining to me like, hey, why don't you join this program? I thought she was pulling my leg when she was like, no, it's a free scholarship. But when I found out everything was already paid for, I cried. Because this was the first time that I ever received a scholarship from anyone. With the scholarship, it was able to pay for my tuition. I am studying full-time because while I study, my parents, they help me with my son. I'm trying to build for our future and also spend time with you. In 5 years, I actually see myself as a nurse in the cancer department because at a young age, my son lost his father to cancer. I feel like it's going to be a big change where I can go to both of my parents and tell them I made it.
Okay, next slide. Our next opportunity is our patient care representative. So this is a 4 to 6 month program. It's 100% online and no clinical externship required. Patient care representatives keep track of records, statistics, and database related to local, regional, and federal program goals and regulations. They work with patients to find and use resources that improve quality care under the guidance and in partnership with healthcare professionals. PCRs also help patients receive services, comprehend policies, and make healthcare decisions. As a PCR, you may interact with patients, family members, and medical personnel to work through any problems in their care. And this program teaches the skills needed to become an admissions coordinator, a case manager, a patient advocate, a patient navigator, or a patient service representative. 100% online, must be able to commit to 20 hours per week to the online course. And again, also prefer 1-year customer service. Next slide. Okay, so our patient care technician are an important part of the healthcare team who administer daily patient care. Under the direction of nursing team, they assist with taking vital signs, patient mobility, repositioning patients, and assist patients with activities of daily living while in the hospital. For those who do not have a current BLS certification, we will drop a link for you to register to take the class, and which needs to be completed by the end of the Human Touch course, which is our prerequisite to the start of the patient care technician program. Okay, so we'll drop that link in. And again, it's a 5 to 6 month program, including required full-time clinical externship. This program is also a bundle for the patient care technician, which includes the acute certified nursing assistant certification. So again, you must have a current American Cross CPR BLS certification by the start of the Pathway program. Okay. And the next opportunity we have available, next slide, is our peer support specialist. So the peer support specialist assists people who have been diagnosed with mental health problems, substance use disorders, or both, towards recovery and self-determined lives by sharing their own lived experiences and practical counsel. And we played a short video.
My name is David Trujillo, and I completed the peer support certification course with Futuro Health. I've been a peer support specialist with the Mental Health Association of San Mateo County for 2 years. As young as middle school, I knew I wanted to help people. My senior year of high school, I was hit by a car, ended up injuring me. I lost my father. Shortly after losing my father, I was homeless. I studied up on psychology, and the more that I learned about it, the more that I learned how to get out of it. Now that I'm in a much better place, I know the roads of recovery, and I can make it easier for others to not have to go through those alone. So I heard about Futuro Health when I was looking up courses to be certified for peer support specialist. I chose Futuro Health because it really worked with my schedule. What stood out the most to me was my instructor. My instructor was there for me beginning, middle, and end, and after. She wasn't just there to check boxes or grade papers. She was there to make sure that I made it.
My name is Jessica Abbott. I work with the Mental Health Association of San Mateo County. Based on my experience, I would hire Futuro Health scholars, definitely. Not everybody is equipped to go to university, not everybody's equipped to go to college, but they want that extra support. They want to get that help, and with Futuro, they can. From what I've seen from David and how his skills have flourished, I would look for it now. I would look for Futuro Health certifications, and I would feel confident with what type of hire I would get. The peer supports meet with the clients, discuss things that the case managers don't have time to discuss. Peer supports take that time to sit down and really get to know the client deeper and have a better connection.
There was a point in time where all I could do was survive, but I'm past that. And now I would like success. The more people that I can help, the more fulfilled I feel that I'm just put on this earth to do.
Okay, thank you. Next slide. And for our last amazing program we have is our phlebotomy. And remember, this is only open to the San Diego area, okay? The phlebotomy program is a 4 to 10 week program with day, evening, and weekend classes available. Externship schedules are 40 to 120 hours, in-person full-time clinical externship. The schedule consists of 8-hour shifts, Monday through Friday, during normal business hours, ranging from 7 a.m. to 5 p.m. Again, open in San Diego. For the 10 weeks, day, evening, and weekends available. Okay. Next slide, please. Although job placement is not guaranteed, Futuro Health has partnered with Allied Up to provide career counseling service to get you started in pathway for a union job with union pay and benefits. So in collaboration with Futuro Health and SEIU-UHW, Allied Up goal is to create an ecosystem to recruit, train, and employ the next generation of caregivers and meet the healthcare worker demands of the future. Our partnership provides full circle education to work and upskill opportunities, post program career coaching for graduates, hard and soft skill mentoring, resume building applications, and AI-based mock interview tools, SEIU-UHW job placement assistance to meet the workforce needed for our union employers, constructive career advice, job market insight, and readiness training. Next slide.
My son was less than a year old, and I got laid off.
I wanted to focus on myself, getting a career, and starting my life again, basically.
I've always wanted to work in the healthcare industry. I have quite a few family members, my mother, my father, and even my aunt, they all work for Kaiser.
I heard about the Futuro Health program through my mom, who also works at Kaiser.
You know, I trusted my mom, you know, she wouldn't come home with like a scam or anything, right? But still, just knowing that it was completely covered it did raise an eyebrow, but going through it, I'm thankful that I took that chance and I did it.
Minimum out-of-pocket expenses. That really helped me out.
How I came to know Allied Up, I was checking my email. I guess that they were all, you know, reaching out to recent Futuro graduates.
Allied, they actually help, you know, with the interview process.
She was able to send me links to some sterile processing jobs that were in the area.
Taking my resume and sending it to different employers.
Now I'm in Kaiser, you know, found a job for what I was going to that program for. It's all kind of come full circle, and it's been really nice to experience.
I made $18 as a sterilization tech. Now I am making $31 as a medical assistant.
Now I'm able to provide for my family. I can go to work. I don't have any debt.
First of all, I don't have to ask for money anymore. You know, I make my own money. I can buy my kids the things that I want.
Being able to make a salary like that at my age, it kind of takes a lot of the pressure off.
And I got a new career that I'm going to retire from.
Without Futuro Health, I would have been able to go back to school.
Okay, and last slide, part 1. Every graduate in this video has become an SEIU-UHW since starting their program. Joining the union is the first step into a union job. You are here because you want to transform your life. So the union transform your life by giving you the education needed to prepare you for a union job. Being in your union gives you a voice and in the fight to ensure access to affordable quality health care. Healthcare justice members are a part of thousands SEIU-UHW associate members, working together so that everyone has a good job, healthcare that works, and a voice that counts. Healthcare workers and patients are working for better healthcare system care across California and beyond. So we're fighting to improve Medi-Cal funding and access, empowering patients in discussions with care providers, and working to fix the dialysis care. As a healthcare justice member, you are advocating in Sacramento and in Washington, D.C. to hold our elected officials accountable to fight against cuts to care and services for 15 million children, seniors, people with disabilities, and others who rely on Medicaid in California. Using your voice and telling your stories to advocate for better patient care. You also can refer your friends and family to a Futuro Health program tuition free. Access to our special member benefit program exclusively for SEIU UHW members, like our SEIU personal loan, our term life insurance, our auto buying program, our travel and retailer discounts, our AAA membership, and that is a $20 a month membership, which means you are joining an organization of patients, students, and healthcare consumers who have joined the Workers to Fight Healthcare Justice and improve our healthcare experiences for all Californians. And we'll drop that link in if you want to become a healthcare member. Okay. So I know that was a lot of information to dissect, and it's good that this is being taped so that you can go back and listen and just go over and think about what program you want to start. But if you are ready later on and you want to get started, we can do that as well. So I'm gonna turn it back over to Dawn, and thank you guys very much. And I'm glad you were here to listen to this amazing opportunity that we fought for when we did our bargaining in 2019. Thank you guys.
Thank you, Yvonne, and Cynthia. Wow, Cynthia's been chilling a little more quiet, but thank you both. Yes, that was absolutely a lot. And this is a dope program. And, I don't know if folks tonight on this call have desires, ambitions to go into the healthcare industry, but if you do, these are amazing opportunities and these are career opportunities. So we're gonna take an opportunity at the end to talk about sign up. And so stay on for that. And we're also gonna have a little bit of Q&A. We're gonna just cover a resource guide and a little bit about organizing before we transition to the Q&A. So hold on tight. Yeah, so thank y'all. Yeah, it's just it's a dope program, dope opportunity, and glad that labor is coordinating with groups like Futuro to make this happen. So, yeah, and so not everybody's in a union workplace. Not everybody here has a union, right? And so, and whether we do or don't, when you're fortunate enough to work in a union environment, you have your contract, right? Cynthia, Yvonne just talked a lot about what they were able to negotiate. So, I think having the opportunity to work in an environment where we get to work to negotiate over our working conditions is everything, right? And unions are also not perfect. I'm a union girl, been in unions for a long time. They're also not perfect and big institutions with all of its challenges, but we need coordinated power. We need collective power. And so where we are not union, we're going to touch a little bit about the importance of organizing. I mentioned this at the top of our call. When we are experiencing, and I saw Kirby, hi Kirby. Kirby is always on point with this. When we talk about experiencing violations of our worker rights, y'all, there are so many ways that we can respond. And I mentioned earlier, and there's some examples here, right? One way to respond is to not respond, right? If we experience a violation of wage theft, a violation of being retaliated against for a protected law, a violation of, being retaliated against for wanting to claim your covered and protected leave acts, or whatever the issue is, right? Doing nothing is also a response. You can do nothing, be stressed out, talk about it with your friends and family, complain and vent to everybody, and do absolutely nothing. That is an option. Another option is leave. You don't like it, leave. Peace out. Right? Like, no one wants to work in a toxic environment. Another action is to file a claim. In a moment, we're going to share a resource guide on ways to file claims, processes, tools, depending on the types of violations that you feel you may be experiencing, right? So, and the state agencies where we file these claims, you know, there's systems that we know are also challenging, but it is important to use them. They are there, they exist, and we're going to cover who some of those agencies are in a moment in the resource guide, but absolutely file a claim. Even if you're organizing, even if you feel like you don't want to do anything else, I would strongly suggest at least get it documented with the state agency. Another option is to take legal action. Good luck. Those are very difficult and you know, long, tedious, draining uphill battles often, but it is absolutely an option, right? And oftentimes you have to have such hard evidence around whatever the violation is, especially particularly with discrimination. I'm going to speak to discrimination because that's oftentimes what we're experiencing. And we have to have like extremely concrete evidence that some action was taken against us because of our Blackness. And it can be difficult. And so, but lastly, right, we want to encourage us to organize at work. And what does that mean? Let me zoom in on this a little bit. Can't read my my own small text, right? Organize, building worker power by organizing at work and or in your community in order to address whatever the wrong was, whatever the violation was, to potentially mitigate that violation, and often in a more timely manner. Melissa, go to the next slide. Thank you. And I'm going to share these last 2 points around organizing and then get you guys this resource guide. But organizing is about building power, right? Power is organized money or it is organized people. We got people. Leveraging our strengths in order to address and resolve the issues or change the condition. A way to play a critical role in problem solving, a path to build decision-making power when we're the most impacted by an inequity, allowing us to address the inequity or to change that condition. Our ability to influence decisions and resources that affect our lives and our work. A route to gaining workplace corrections potentially faster than waiting on state agency processes or legal processes to play out. Empowering other people to creatively and address those conditions, right? Some of these different steps that can be taken can include, you know, workplace actions, petitions, delegations, community engagement, public attention if needed, leveraging external pressure if needed. But let me pause here because even before these examples there around ways where we can empower others, what isn't here that, Melissa, I will include this next time, but I'm going to offer these maybe like 6 points. One is know your workplace. Know your workplace. Sometimes we work in a small place and we do, right? And sometimes we work in a big place or in some institution or some big corporation and we don't, right? So the encouragement is to know your workplace, map it even, right? Know who the various departments are, know who all the staff and employees are, know who all the decision makers, managerial positions, supervisors, etc. Know the workplace. And know the policies. Know what your rights are in those policies. Know how human relations work and how they don't work. Know what your rights are. Someplace at work, those rights are posted so that if and when something happens, hopefully they don't, right? But if and when they do, you have some familiarity with like, oh, is this just some, you know, microaggression or some personal thing, or is this an actual violation of a potential right? But if you don't know the rights, you may not understand it's a real violation and you might take it personal. Or oftentimes, y'all, it's really just something personal, right? And it may not actually be a violation of a right. Number 4 is to, number 3, be in relationship with your folks. Oftentimes we go to work, we leave, we go home. We don't want to be bothered. Let something happen. You're going to need your people. So the encouragement is to be in relationship with your coworkers. Go to lunch with that person you see all the time and you just throw your head up or head down and be like, what's up? How's it going? You keep going, right? But take the time out to sit with somebody new, talk to somebody new, know your people at work. Identify the issue or the problem when it happens. Is this a broad problem? Has this been going on for a long time? Or is this maybe just a one-time or more isolated experience or situation, right? Because that might help determine what the right approach is when you look at these tactics, if you will, around a petition, a delegation, public attention, right? If it's a long time thing, you might want to think about what's the small action we could take. And then the next step might be, we might need to consider some type of escalation in order to advocate or make the change happen, or to communicate for a change. And then the number 5 is advocate for clarity, for correction, for being made whole, right? And so if you're in relationship, you know who your folks are, you know which departments to go to and or not go to, right? And be in communication and coordination around a plan, right? Depending on what it is, depending on if it's a violation, a personal thing, whatever it is, right? Because organizing applies, whether it's a concrete legal violation or not. And so having that skill set, having that as a practice, a tool in your pocket, can help mitigate a lot of challenges at work. Yeah, and then lastly, right, just, as in part of that relationship building or in that plan, and folks knowing their rights, also know their rights around retaliation, right? And include in the education with folks the fact that, oftentimes if it's excuse my language, but if it's a shitty employer or a manager or a boss and they really are wrong, right, then, the likelihood of them potentially breaking the law to retaliate could happen. We hope it doesn't. We hope they're not so foolish or stupid to do such a thing, but we know sometimes it can happen. So let's know our right, inoculate each other, know that it could happen, but knowing our rights will prepare folks on how to respond if and when something like that could happen. So those are just a little bit of tips around organizing. Throughout this Edu-Series over this year, we may have some sessions to go even deeper, do some role playing, some practicing around ways that we engage with each other around organizing. What's an organizing plan? How do you map your workplace? Like all those kinds of things. So before we transition, we want to give you all this resource guide. For those of you who have been with us before, you may have already seen it, or you have it. Hopefully you've used it. Hopefully you didn't just come on, get the link, and you never look back at it again. A lot of work, energy, effort went into creating this, and it is a really resourceful tool. So if we can, Melissa, are you able to open up the resource guide?
Yeah, we already put it in the.
Oh, you put it in there? Can you share screen for it, or could I?
Yeah, go ahead. Cami put it in the chat a few minutes ago.
Okay, thanks. This is the Worker Rights Resource Guide, everyone, with the SoCal Black Worker Hub. So just gonna skim through it, but you have it there. Keep that link handy somewhere. These are the various, there's state agencies in there. In here is information and state agencies and how to file a claim and contact information on all of these various protections: health and safety protections, wage and hour, discrimination, workers' compensation, retaliation, COVID-19 worker leaves and benefits, and Department of Industrial Relations outreach campaigns and initiatives. So this is just, one example of what's in each of these sections, right? There's a mission, an example of a violation of this particular one, wage and hour or paid sick leave, what the statutes of limitations on them are, how to file a complaint, how to report a labor law violation. Here's the website to do so. These are direct contacts, y'all. This isn't just like pull these off the website. We have spent a year building relationship with representatives. We mentioned this in the beginning, relationship is key. Building relationships with these state agency representatives so that if and when any of our Southern California Black Worker Hub members are experiencing something, they know it, or you call them and say, this is how I learned of this relationship. I have this challenge. Can you help me? They will help. And so this goes for the same for all of the, so I'm gonna stop sharing. And let me get back to our flow. Yeah, so that's a little bit about organizing. That is a little bit about, that is a tool to please take and keep and use it on the Workers Resource Guide. I'm going to pause right here on all of this info. You just got a lot on what the career pathways are in healthcare. So we're going to move to just a couple of questions. Are these the questions, Mel? And so, yeah, like have folks, let me see how many people are here. There's 22 people here. And so, well, like 20 or so. And so, if you've had experiences in the workplace where you feel like your rights have been violated, what have you done? Do you have questions for, if you have questions specifically around the sign up, we're going to get to that in a moment, but just more generally and broadly, are there pathway options with SEIU and into the healthcare industry? So we're just going to open this up generally to some questions that folks have before we share a little bit more about what's happening and the signups. So open for questions. Hey, yes.
Hey, I'm in the dark. I'm trying to keep the mosquitoes off of me, so I don't have much backlight. Listen, this was amazing, awesome and amazing, so inspiring. Thank you to the Hub for bringing this to us because what I'm getting from people who inquire around work and work issues from Long Beach at the Long Beach Black Worker Center is just the in general feeling of I don't know, like I don't know what to do. I don't know what I should do. And even amongst employed people, Dawn. And so something that came up for me and something that you said earlier, and I can't remember what, but I get that people in general don't feel supported. That's what I feel. In this call, like I want to share this call with as many people, this video, as many people as possible, because these conversations aren't happening every day. But also to the extent that you get complimentary tuition for a small investment, which is just your time and investment in your own life. Now, something I want to share, and I won't hold you too long. I am a 30 plus. I graduated from my healthcare career program in 1992, and it has served me so well. Times of depression, times of, we've had depression, they call it recession, times of husband being unemployed, and times of three kids needing braces. And I was able to support my family through healthcare. And so I'm so lit up, but this call is just like got me so excited because I think in doing the work around supporting Black workers and discrimination and things, I really forgot how tangible skills in healthcare really are. And as a 30-year-old veteran in the industry, my top picks are emergency tech, because that's a 3-in-1.
Yes.
Community health, because that's the future of healthcare. We're going to decentralize medical centers and rely on community health techs. And then also medical assistants, because they can make a good, decent money. Largely Hispanic driven, but that's because it is the good money. And then next to that, if you want to be a nurse, you got to be a CNA first. So that's just my 2 cents after 30 years in the field. Thanks.
Yeah, thank you, Dana.
Yes.
Oh, I thought that was a hand up, Cynthia. So you got a question about your own stuff?
Carla has her hand up.
Okay, great, Carla.
I just wanted to share that I am a CNA. Usually I don't have a problem at work, but I feel like, well, actually, usually if I feel like I'm experiencing some discrimination, I kind of just, let it go and still work. But this time I'm working through a registry at a hospital and I apply for direct hire. And I know there are some reasons that they're not hiring me, and people have told me possibly why I haven't been hired yet. So it is difficult for me to deal with it, but I'm still working in the same place. And I really didn't want to file with EEOC, but I did. So far, the response I've gotten from EEOC has been pretty good. Well, actually, it was with the city, it wasn't with the state. Um, I'm like waiting. I don't know for sure if they are going to do an investigation. I know that might take, some time, but I just wanted to share that I did go ahead and file a complaint. So far, it's been a positive experience.
Carla, are you in Long Beach?
No, I'm in Oakland.
Okay. Okay.
Yeah,
Gotcha.
it usually takes about, you said you just filed it and you haven't heard back yet. It usually takes probably 7 to 8 months or so before you even get a representative to review your claim, and then they'll reach out and have like an interview process with you. And then once that interview process gets going, that could be, a month to 2, maybe 3, but just to get the interview started, it's going to take about 7 to 8 months. So just heads up. Yeah, so I don't see any other hands, and I'm looking at the time, and I want to give time for folks who want to explore what the actual enrollment process is. So before we get to that, we want to make sure that folks have some clear calls to action around things that are coming up with the Hub and the Black Worker Centers across the region. So I'm going to give this to Melissa, and just thank you again to Yvonne and Cynthia. Yeah, and that'll end my part. I'm giving it to you, Melissa. Thank you.
Everybody. We have coming person Black Worker Summit in San Diego. It's being hosted by the San Diego Black Worker Center. So save the date. It's Saturday, September 6th. You can find all of our events on our website, so blackworkersunited.org/events. If you can put that in the chat, Cami. I forgot to add that link there. So it's going to be, I think it starts early in the morning, over by afternoon. There are going to be some great workshops. The Hub is putting on one as well, meet and greet some other folks in community. We're inviting people from all across Southern California to come. So it'll be a really nice event. They put on a really great gathering there. So join us. And then we will continue to have these virtual online Black Worker Power Building Edu-Series sessions on Zooms through Echo Black Voices. So you can find those dates, the full calendar, and the RSVP link on our website /Echo. Our very next one will be on Wednesday, September 24th, same time, same channel. So that's our information. So blackworkersunited.org/events. And please follow us on social media. We are on all the platforms at SoCal BW Hub. You can email our colleague Darren if you have any questions or want to follow up from today, dlewis@bwhub.org. And on our website, you're also going to find the recording from today if you want to share it with others, watch it again, and you'll also find the slides. The slides are currently there on our Echo page. So that's it for me. Pass it back to Dawn and our presenters.
Thank you, Mel. There are 2 other things on September. Now I might have forgot to make sure that we included this. I think it's the 2nd or 3rd. I got to double check. But next week, it's either the 2nd or 3rd. I'll see if we can find it before we get off. LA online, LABWC is having an EEOC training. So Sister Carla, you might want to join that. I'll see if I can find the link to that and drop it in here before we get off at 8. And then, yeah, so it's an EEOC training. And then again, if you're in the LA area, if you're interested, this is the first Black Worker Center, over here on this side of the coast that was started by our now Senator Lola Smallwood Cuevas 15 years ago. And it's going to be a dope celebration of just Black worker power. And yeah, so that'll be open to you all too. And we can maybe share some of this in a recap email after tonight. So yeah, that is it for folks. If you are not planning on signing up, again, you're welcome to stay on to hear about the process. This may be information you want to share with others. And of course, if you are interested, this is the time. So I'm going to pass this back to either Yvonne or Cynthia, and you can walk folks through what enrollment looks like.
Okay, I'll continue. So let's get started. So I'm going to walk you through your student expectations, show you how to apply and what to expect after you apply. And so you can hold your questions to the end. If you have a couple of questions, we'll answer. Okay. When you do apply, you would need, again, the name, facility, last 4 digits of the employee number, and the division, whether Kaiser or hospital. And so we want our students to be start ready and know what's expected of them while they're in the program. So we want you to be accountable. This is ultimately your education and career. So just take ownership, understand your requirements, and engage with your support team along the way. Be proactive. Keep your phone numbers, email addresses current on your Futuro portal so your support team can reach out to you. And be engaged. Just regularly log into your Futuro Health portal and your education provider portal. Check your email and phone numbers for important messages and updates. And be organized. Just review the average classwork, class hours, and study time that are required for your program, and just create a plan to be successful. Be prepared. Just review your in-person requirements. For example, if your program has those full-time to fulfill your externship, your clinicals, or your labs, to make arrangements for those. And then, just reach out, resourceful, just reach out the moment you have any questions, just don't wait till the last minute. Okay. Next slide. And so you're not alone while you're in the program. Our goal is for you to graduate from the program. We want to make sure that you are aware of the role of our Futuro Health Success Coach, who will be part of your support system while you're in the program. So the Success Coach will connect with you after you've been approved to participate in the program. They'll work with you throughout the next steps of enrolling into your program. They'll provide you with program information, contact information, and other resources key to your success. They'll also be your point person as you prepare to start your program, and will continue through at least the first 6 months of your program. They also will support your ongoing success, provide individualized coaching and goal settings, and work with you to celebrate any wins, overcome any obstacles. As an adult student, you're juggling a lot outside of school, so they can also provide support with time management strategies to ensure you have an effective plan to complete your program successfully. If you start to feel unusually stressed, overwhelmed, they also can connect you with a crisis support specialist, whether you're struggling with food, housing, insecurity, financial issues, anxiety, grief, personal safety concerns, or just simple high stress, right? Due to the amount of responsibilities that you may have in your home life. You just please ask for help. You're not alone in your journey. And then also, next slide. The school that you will attend will also have support services through their instructor and counseling teams that will guide you through the program. Futuro Health is not a school. It's a nonprofit organization created by SEIU-UHW and our employers to cover the cost of your tuition. So you would need to complete an application and enrollment process with the education provider in addition to the enrollment with Futuro Health. Acceptance into Futuro Health does not guarantee acceptance into the college. The education provider will be the primary point of contact 2 weeks prior to your student start date and throughout the duration of your program course. Okay. They also will determine the length of the program, the hours, and the clinical externship hours, and the locations. And it varies from education provider to provider. They also can answer questions about your coursework, grades, submitting your assignments, passing, failing, reasonable accommodations, missing class, tutoring support, etc. Like if you want to ask for an extension or an assignment, you will need to contact the instructor and other support. So the education provider will award your certificates when you complete your class. Okay. Next slide. So let me see what slide I want to go to. Okay, so the application portal, remember, if you're not start ready, but if you are, you need to be on a laptop or a computer and make sure you have the referring SEIU members name, facility, last four digits of their employee number, and their division, whether Kaiser Hospital or Healthcare Justice. So, and that would be my information that will be dropped in the chat for you guys, okay? And so if you gather the information, this is what will look like. When you click on the first one, the application portal, it'll ask you what is your relationship to the SEIU-UHW, and then you guys will select that everyone here that you are friend and family. Next slide. Of a UHW member. The next question is, where is your referring member from? Are they from Kaiser Hospital or Healthcare Justice? You will select that. And then you will select who your referring member is, which you'll type in the facility of the referring member, and you might see the drop-down choices. If not listed, we usually have a support team that also, but you'll put in the name of the referring member's last four digits of their employee ID. Once you've clicked that, you will get this, which is a congratulations, that page that say you are eligible to apply for Futuro Health course. You'll be directed to submit your first name, last name, and mobile number. Click continue and it will redirect you to your Futuro Health portal to create your own account. Okay. Next slide. And then you will sign up. So this is where you will sign up. I'm just showing you what the screens look like. You'll sign up to create your own portal and then begin to do your application. Next slide. Once you're logged into your Futuro Health account, you can see all the programs open for enrollment. You can view more and apply in each pathway program. And you can view the median salary and search program locations by entering your zip code. And you must live within a 50-mile radius of a school to apply for that program. Next slide. Okay, once you've selected your pathway program, make sure to complete all surveys and assessments, submit your application. And there are some surveys and assessments that need to be completed to submit your application. If you see an action required that or that your application is incomplete, that means you did not finish your application. You'll check your email for updates frequently, as this is the primary way that Futuro Health will communicate with you. And be sure to check junk, spam, and all of that. What to expect after. Next slide. You should receive the first update by email within 48 hours of successfully completion of your application. Once approved, you should hear from a Futuro Health Success Coach to set up your one-on-one to discuss the program details, externship requirements, and your program fees. It's important to prepare for your one-on-one. Have your high school diploma or GED ready to send it to the success coach. It's fine if it's from your home country as well. And if you need to get a copy, you can contact the school district and request, official transcripts. Have your $150 application fee ready to make an online payment. And finally, have your calendar on hand so you can select the start date for your prerequisite, which is the Human Touch Healthcare course. This is a mandatory 6-week online program, which you must pass before you can start your program. Okay, next slide. Your student journey is that you'll meet with your success coach, which you expect to receive an outreach, which is within 1 business day, and that's just the email that says congratulations. You'll select your start date to confirm for the Human Touch Healthcare course. Remember, that's mandatory 6 weeks course before you start your program. You start your 6-week Human Touch course. And one thing about that is, like I said, there were vaccine requirements. There was, maybe you can't find your high school diploma, things like that. You have the time to get all that done. You're taking the courses that you need, your CPR and BLS. You can go through all that while you're doing your prerequisite. So you'll be start ready when it's time to meet with the education provider. Okay. So then, once you're done, you'll meet with your education provider and discuss options and finalize your start date, your complete enrollment and immunization requirements to get started. So you see 1 through 4, you have plenty of time to get everything that you need done so that you're start ready. At midpoint, in mandatory meeting with the success coach to discuss your progress and the upcoming externship readiness. And that's if you chose a program that has an externship. Receive career counseling through Allied Up, and then complete your unpaid externship program Pacific, and then also go through job placement with Allied Up. You'll meet with your career counselor. Okay, so we'll open up for questions right quick if anyone have any. Again, it's a lot of information, right? So if you're not start ready today, that's completely fine. Maybe we can set up something with Don that maybe you guys just want to do it all in a group to sign in. We can just open it up for questions now. You can go back over this and then you can, say, all the programs that I listed. You're like, I'm more interested in that. I just wanted to give you guys the information of the program, let you know what type of, jobs you can get from doing the program, and just knowledge is key, right? So I just wanted you guys to have all the information. So you can go back and listen to it. And then if you don't have a question today, or if you have a couple of questions, we can go ahead and answer. If not, we can, do something else. Maybe Don could set up something, like I said, when you are start ready, we want you guys to graduate, right? We don't want you to waste a scholarship. It's 1 scholarship per person. If you start doing and must stay in communication, so that they know that you're serious, and that you want to begin your career in the healthcare field. So any quick questions you have, I'm open to answer.